Good evening and welcome to tonight's Instagram from Fertility. My name is Professor Charles Kingsland and I'm the Group Director, the Group Clinical Director for Fertility. And I'm broadcasting tonight from Fertility in Liverpool on the banks of the Mersey, where I work with my lovely colleagues Amanda and Ashley and Ella and Helen and Kathy. So tonight, what we're going to do is we're going to talk a bit about tests. That's for you might be starting your fertility journey, or you might be halfway through it, or you might have even completed it. But what I think is important is that we just talk tonight a bit about the vital tests you need, tests that are not so important, and just give you a background of what might be best for you. But I'm going to start with a bit of philosophy, because I often wonder why people feel the way they do about fertility problems. 1 in 6 of us will have a fertility problem sometime in our reproductive life. That is, we will have a difficulty conceiving at a time when we want to. So if you have a particular fertility problem, sooner or later, that's not resolved, sooner or later you'll go and see a doctor. Now, or a nurse practitioner, or somebody with a specialist interest in infertility. But what I want to ask you first is, what do you think is a disease? You know, doctors treat diseases. We all talk about diseases. So what's a disease? Have you ever thought about it? Because I often say to my students, I'll say, right, okay, you're trained to be a doctor. You're trying to cure diseases. What are we trying to cure? What's a disease? Well, we all have lots of ideas what we think a disease is, but if you look at the word disease, dis means abnormality, okay? Dysphoria, dysmenorrhea, abnormal periods, disengagement. It means an abnormality. And ease is easiness. So a disease is anything that causes an abnormality of easiness. Now, a lot of my colleagues would say, when I was practicing gynecology in the teaching hospital, well, fertility is not really a disease. Well, actually, fertility is one of the definitive diseases, because one thing that happens to you when you want to have a baby and you can't have a baby is you become diseased. You become abnormally easy. Okay, and if you just have to wait in a waiting room in a fertility clinic, and you see lots of people who are very anxious. So people will say, why do I feel so bad? What is it about fertility that makes me feel so bad? And people don't understand. Well, for those of you who've done biology O level, you'll know that there are certain characteristics in humans or mammals that are common to all of us. Whether you're a dolphin or a rhinoceros or a human, we have some common mammalian features. We all move, we all grow, we all reproduce, we all respond to our environment, we all eat, we all die. Whether you're a whale or a baboon, we all do those same things. So, if I said to you, I want you to take a deep breath in and stop breathing for 5 minutes, I will guarantee you that in 30 seconds, all you'll be thinking about is breathing in and out. If I said to you, you can't eat for a fortnight, this time tomorrow, you'll be craving food. If I said to you, you can't move a muscle for 5 minutes, all you'll want to do in 30 seconds time is twitch. So if I say to you, or your body says to you, you can't have a baby and you want a baby, all you think about is babies. Every minute of every hour of every day of every week. The first thing in the morning, the last thing at night, you'll think about it. And then your mind will start playing tricks on you. All your friends are pregnant and you hate them, but you feel terrible because it's not their problem, but you feel for them, but you just don't want to mix with them because that's a human. That's just human. Or everybody's pushing a pram. Or every shop on the high street is a baby shop. Or as one patient said to me some time ago, do you know, Professor Kingsland, you could blindfold me and put me into any supermarket in Liverpool and I would be able to find the nappy aisle. Now, that is the feeling. And then, of course, people will say to you, and people who've not experienced fertility will say to you, well, it's not the end of the world. Come on, we can. But to you, it is. And then, of course, the people who love you most, your parents, will try and console you, but they don't know what it's like because, there's no point in them saying, I know what you must be feeling, because you don't. Nobody else knows how you're feeling. So to feel stressed is normal, and to feel that peculiar sensation of disease is normal. So it's absolutely vital that when you feel like that, you try and seek help. Now, we normally say that most couples will achieve a pregnancy within 2 years of trying. Okay, so if you're having regular unprotected sexual intercourse or inseminations, then normally the majority of people will have conceived after 18 months to 2 years. But if you're feeling terrible after 6 months, why wait? You may not need any treatment. Indeed, a lot of you won't need any treatment. But sometimes it's just reassuring to get that reassurance from somebody who knows. And this leads you on to another important factor before I start answering the questions, because there's a lot of questions, is what do doctors and nurses do, or practitioners? Okay? Whoever you go and see. Now, I don't know what you've actually thought about, when you go and see a doctor, but doctors actually, there's nothing in the contract with a doctor or a nurse that says, I'm going to make you better. When you go and see a doctor, it's not their job to make you better. Obviously, nowadays, you go to, the vast majority of you will get better when you see your doctor. But the prime role of a doctor is not to make you any worse. And 2,000 years ago, in the time of in ancient Greek, the first modern doctor, Hippocrates, actually coined the Hippocratic Oath, which we all doctors swear to when they qualify. And the first thing is, I won't do you any harm. Now, that opens up a whole plethora of things that we can do that might not do you any good, as long as they don't do you any harm. And a lot of couples will end up going down the wrong rabbit hole very early, doing things that are of no benefit. But as long as it's not harmful, then it's that's okay. And there are some things that can indirectly be of benefit to you. So, for example, let's royal jelly. Now, we all know, if you've had a fertility problem, you read on the internet, royal jelly, that's good for you. Royal jelly, made by bees, reassuringly expensive, that's got to be good for you. What's it good for? I don't know. There's no scientific evidence whatsoever that is of benefit for you. Folic acid, okay, folic acid, that's got to be good for you. Well, yes, it is. There is lots of scientifically proven evidence that if you're trying for a baby, you take folic acid, it will give you a better chance of having a healthy child than if you don't take it. Similarly, smoking. But there are health food shops full of stuff you don't need. Now, that doesn't mean to say that you shouldn't buy them. Why not? As long as you are informed that there is no scientific evidence it's going to do you any good, as long as it's not harmful, it might make you feel better. And if that makes you feel better, then great, do it. Because as long as it's not harmful. There are lots of things we do, like there are lots of complementary therapies that have not proven scientifically to be benefit, but if they're not harmful and you derive benefit from them because they make you feel better, That's fine. It's a bit like, do you really believe that changing your diet radically and eating nothing but avocados and walnuts is going to improve your fertility? Really? Do you really believe that eating avocados at the expense of other food is going to give you a better chance of getting pregnant? Of course not. However, if you eat avocados, then you probably eat other healthy stuff. And there's no doubt that eating healthily is better than eating unhealthily, of which avocados is a healthy, nuts, berries, fruits, all those sort of things are good for you. But by itself, don't alter your life and reduce the quality of your life just by, eating all stuff you don't like. It's the same as alcohol. If alcohol stopped you getting pregnant, well, there'd be no babies on the planet. But the key is, don't drink too much. Occasionally, it's fine. But I see patients come to my clinic and they say, oh, my partner, I've stopped him drinking. He doesn't drink, he hasn't drunk for the last 2 years. And he's sitting there, he's miserable. And he's thinking, yeah, and I really enjoy it. And that makes me sad. And then when it makes me sad, my libido goes down. And then I can't have sex. And the whole sort of things run on. So I'm not suggesting you go and get drunk every night, but 3 or 4 units of alcohol, 5 units a week is absolutely fine. And that leads me on to tonight's topic, which is, tests, investigations. Now, we're humans, so we all love a good story. We love a good story, and you see stories on the internet. I do this, and I've done that, and I've had that test, and I had this test, and I got that treatment, and that got me pregnant. We like those stories, irrespective of whether they are true or not. And it's, like, for example, if I said to you, look, this is my fertility pen, okay? What I want you to do is, this is a good treatment, and I want you to put it in your lapel, and I want you to wear it for the next 3 months. And the ink will improve your fertility. So you've got to wear it next to your skin. However, that fertility pen will cost you £100. Now, I can guarantee you that, and you might think, well, that's stupid. But if I painted it green and called it the Fertilo pen and got Boots to sell it, I would sell it. And and you know what? I'd sell 10 and 2 or 3 people would get pregnant. And they'd say, Professor Kingsland's Fertilo pen is fantastic. I'm going to buy it. We tried and we bought the Fertilo pen and we got pregnant. Nothing to do with the Fertilo pen. It's coincidence. Okay? It's coincidence. And a lot of treatments, if you do get pregnant, it is coincidence. So, what tests do you need? What you need are evidence-based tests. Tests that are of unequivocal benefit to you. Okay, and I just relate back to the basic physiology of the difference between boys and girls. Okay, boys are sperm factories. We have all the ingredients in our bodies to make sperm every day of the week. Some days we're good at it, some days we're bad at it. As we get older, we get poorer at it. But we can make sperm right up until the day we die. Okay, we ejaculate them out and make some more. Girls, on the other hand, are egg warehouses. All your eggs are in your ovaries on the day you're born. You can't make them. You can't make them better. You cannot improve the health of despite what people say, you can't make them better. What you can do is to stop making them worse. So, be fit, healthy, eat a balanced diet, but unlike sperm, eggs will get older and they become less fertile. So age is very important for a female trying for a baby. So the younger you are, the better it is, generally speaking. So, bearing that in mind, What tests do we need to know? Well, what we need to know when you've been trying for a baby and you're anxious and it's not happening and you're monitoring your ovulation, there are 3 tests that we need to do. Bearing in mind that the cause of fertility is 50-50, 50% female, 50% male. Have I got eggs in my ovaries? Okay. Are all my bits in the right place? And do the sperm that are deposited in my vagina have the ability to swim right the way to my egg? Bearing in mind that for a sperm to swim from the vagina to the egg is the equivalent of a man swimming from Liverpool, just out there, to New York at 600 miles an hour. Okay? So they are the 3 most important tests. Now, have I got eggs in my ovaries? Well, there is a hormone called anti-Mullerian hormone, AMH. It's called anti-Mullerian hormone because the Mullerian ducts in the developing embryo are the little tubes that turn an embryo into a girl. And AMH is produced in an embryo to stop those Mullerian ducts forming. So it actually makes an embryo a boy. But that hormone disappears in humans and then reappears in the little cells surrounding the female's egg, normally in adolescence. And there's a direct correlation between the amount of AMH and the quantity of your eggs. So the more AMH you've got, the more eggs you've got. It doesn't tell you about the quality of the eggs. Other things tell you about the quality of the eggs: your age, your weight, your state of nutrition, whether you smoke, whether you have any nasty diseases or other illnesses. That'll tell you. But the AMH will give you an indicative account of the number of eggs you've got, which is really important to know. The next test, the second test, is a pelvic ultrasound scan. So that of the female, okay, to make sure she has 2 of everything down the side and 1 of everything up the middle, okay. So we want to look for the ovaries to make sure that they're there. We also look for what we call the antral follicle count, and that's the number of little follicles. They're the fluid-filled sacs in which eggs grow around the outside of the egg, and that will tell us. Give us an indication, like AMH, of the number of eggs that there possibly will be. So AMH, AFC. We love to abbreviate these things in medicine. Anti-Mullerian hormone, antral follicle count. Very important tests. Scan pelvis, uterus. Is it healthy? Is it normal size? Are there any lumps or bumps in it? What does the endometrium, that's the lining of the womb that the embryo sticks into and grows the baby, what does that look like? So, and it, together with the history and the scan and the AMH, AFC, that will give us the basics of tests. If there's anything else in the history, like you've had problems with your thyroid gland and prolactin, or there are problems with your pituitary, well, we can do those tests as well. But they're the important ones. AMH, ultrasound scan. And the next test we do, the third test, or you should do it actually probably first, is a semen analysis. So you abstain from sex or ejaculation for 4 or 5 days. You then produce a sample, which we then analyse. And we want to bear in mind that the sperm are little wriggly things and they're swimming. We want to see the count, the number of men that jump into the River Mersey or the River Thames, whether they're doing front crawl, backstroke, doggy paddle, and how many look normal. Okay, that will give us an indication, just an indication as to how viable the sperm is. Okay, and these are the numbers that we want. An AMH test, we want it ideally to be around, I don't know, 10 to 20. It's much better to have an AMH of 10 when you're 20 or 25 or 30 than having an AMH of 20 when you're 45. Because all it means when you're 45, you've got a lot more older eggs. That doesn't mean to say they're not fertile, but they're less chance. And I see patients coming to me and saying, oh, my doctor says my AMH is low and it's 8. But if you're 25, that's probably okay. Okay? So but you need to get that interpreted. Okay? 10 to 20 as a rough guide. Ultrasound, we've spoken about the ultrasound. Now, sperm test. How many men do we want to jump in? 40 million. We want about 40 million. How many do we want to do? How many do we want to be doing front crawl? 40%. Okay? And how many do we want to be normal? Surprisingly, only 4%. Is only 96% of the sperm that us males produce are abnormal. And that is normal. But we want 4%. Okay? Count 40 million. 40% front crawl. Well, progressive motility we call it. And 4% normal morphology. Now, if you're single or you're not contemplating having babies, then why not do a test for your own peace of mind, just to see how you're, because we at Care Fertility can actually interpret them for you and say, well, actually you're sitting right in the middle of normal. But of course, having babies is a combination. It's two people. So you get highly fertile males and highly fertile females, and they split off and they click like that. And they're the sort of people who say, I only have to look at David and I seem to get pregnant. Well, that's them. That's highly fertile male, highly fertile female. Then you might get a poorly fertile male and a poorly fertile female. And they may take forever. And then you've got all us average ones. Highly fertile male, poorly fertile female, highly fertile female, poorly fertile male. And they may take, 6 to 9 months to get pregnant. Usually, not always, but usually when you plan a family and all things, with a fair wind behind you, you get pregnant quickly. If you're not pregnant after 1 year of unprotected intercourse, okay, that's timing your intercourse in the middle of your cycle when you ovulate. That's a fourth test, which is important. Then that's the time to really consider, well, I wonder whether I should be just seeking some advice. And you either go to your general practitioner or your local fertility clinic. And Care, we have 21 clinics throughout the country. We have a central patient inquiries, and all you have to do is to pick up the phone if you want any tests, and they will give you the information about your local clinic, how we can help, or indeed where we can point you in the right direction to seek the help that you need. But don't sit there stressed and diseased if you feel like that. Get some help. So they're the tests. Another test, the one final test which is important, is, if you really want to, is check your ovulation. We tend to release an egg in the middle of our cycle. We actually release an egg 14 days before the start of our next period, not 14 days after the beginning of the last one. If you've got a regular 28-day cycle, there's an 85% chance that you will ovulate. Okay? And you can buy simple ovulation testing kits from the chemist. Clear blue is the classic one. You get the flashing smiley face and then continuous face, and that tells you when you're ovulating. If you have irregular cycles and you're trying for a baby, that you might have plenty of eggs, but you might just not be ovulating. And in fact, if you have irregular cycles, only 15% of women are ovulating. That doesn't mean to say you haven't got eggs. It just means to say that the system isn't working in a coordinated fashion, and that might be a flag to tell you time for me to seek some help. Okay, so there's lots more tests. Some of them are, but people who come and say, Professor Kingsland, I've been told, or I've read on the internet that I might be short of alpha, beta, gamma glutamyl placental transferase. Could you test me? Well, why? There's probably no evidence. There's probably somebody somewhere in America that's that said, well, you could. I've been told I need this test because 1 in a million people have been found to be deficient in this particular really rare enzyme. That's very unlikely. The other thing that doctors will say is that common things are common. Now we all like to think that, just going on this legend story, that we're unique. Well, most of us aren't, and most of us have the diagnosis in front of us. So you don't need to start having your blood sent off to some weird and wonderful laboratory somewhere and then spend a fortune on a test for which there is no treatment. There's no point in testing for something if there's no treatment. Test the things that can make a difference. How important is testing the estrogen levels for a successful IVF treatment? Not that important at all. What you need is lots of scans to see whether your eggs are growing during the IVF treatment. Now, sometimes an estrogen test might be of help. It might just help you to see whether the follicles have got eggs. But generally speaking, you don't need an estrogen test unless your doctor advises you to have one. The scans will tell us all we need to know. We did IVF with ICSI sperm, has since improved. So our sperm has improved. So would IUI be suitable? We are over 40 and it costs less. No. Sometimes IUI is false economy. The chances of getting pregnant with IUI are less, and before you know where you are, you may have spent £1,000 each month for 6 months, and it hasn't worked. And generally speaking, although you would need advice from your own doctor, your own fertility specialist, is that if your sperm has been abnormal, then IVF has been unsuccessful. Try IVF again, particularly if you're 40, because IUI, it is cheaper, but it might be false economy. I miscarried with a genetically normal embryo. That's very sad. What test would you advise I could have done other than the basic ones offered at the hospital? Well, that is a case where if you've got a genetically normal embryo and it's been placed in a normal uterus, then your chance of getting pregnant should have been over 60%. So in your case, this is important that you seek advice from the specialist, because there may be something that we can do that's over and above that's what's already been done. And there's testing on your endometrium, there's ERA testing, there's lots of tests. And again, are they valid? Are they evidence-based? Are they worthwhile? Is there a treatment? Before you start embarking on expensive tests, ask, will this be relevant to me, and where's the evidence? How can I best prepare for my fertility tests? Anything I should be doing in advance? Yes, be healthy, eat well, try and get your body mass down to between 25 and 30. If you can't, no worries, but try hard, because there's no doubt that weight is related to fertility. And if you can't get down to your good boxing weight, grow a few inches, because that will bring your body mass down. But don't smoke, reduce alcohol, eat a healthy diet, then have your tests. There's no point in binge dieting or telling your partner to stop drinking and go to the gym 5 times a week, because that's of little benefit. Just prepare, just do the simple things. Good diet, weight, exercise, healthy lifestyle. Out of female fertility tests done at assessment stage, are there any particular tests that are the most important? They're the ones that I've told you. There are other tests that we don't have time for today, but there are tests that we can do. But they're the eggs. How many eggs have I got in my ovaries? Are all my bits in the right place? Do the sperm make the journey? And am I ovulating? And just an important one here that I'm picking out. There's a question here. I want to know the difference between SOS sperm test and a DNA fragmentation test. So sperm, this is an additional test, okay, which is getting increased popularity, and I think it's worthwhile doing, although the evidence is not complete, there is a lot to suggest that this may be an important test. It's to do with oxidative stress. So the sperm, like all of the cells in our body, have to breathe in, have to use energy, and they release oxidative stress molecules, which are important, okay? And the stress molecules are kept in balance by antioxidants, which are naturally occurring antibodies that actually fight the or keep the oxidative stress in check, okay? Sometimes the oxidative stress becomes out of control and can have a negative effect on the sperm, and that at that point the sperm become damaged, and that's when they throw out fragments of DNA. That's the genetic material, and we can measure the level of oxidative stress and the level of DNA fragmentation if there is any. SOS, oxidative stress tests, are actually quite cheap and straightforward, and I think are worthwhile doing if there's a suggestion that there may be a sperm problem or unexplained infertility. Now, this is the number. If you do have high levels of oxidative stress, antioxidants and your antioxidant levels are not up to keeping them in check. Vitamin E is the best antioxidant, and it's cheap and it's available and it works, okay? And it lowers your stress molecules. However, if your stress molecules are low, and you take vitamin E, that can have a negative effect because it can increase the antioxidants to such a level that your stress molecules, which are good, it's good to be a little bit stressed, are damaged, and then the sperm don't work. So this is a classic example of where you're treating a disease that doesn't exist. You know, why are you taking it? No idea. Why do you take evening primrose oil or royal jelly? Well, you've got to ask, why am I taking these things? Are they doing me any good? They may not be harmful, but they may not be doing me any good. Okay, so that's there are lots more questions coming through, but I hope that that's giving you an idea of what tests you need and what you need to ask. Okay, don't sit there in silence. Don't be stressed out and think, well, I've got to wait 2 years because I've only been trying for 6 months. That might be enough for you, and you can always seek help. Okay, as I said, Care Fertility, just pick up the phone to our patient inquiries. That's what we do. This is what we do all the time. That's what we're here for. Okay, to help you, give you the best chance of having a family. And if you need treatment, then we can point you in the right direction. It may be NHS. You may be able to get NHS funded treatment, or you may, of which Care do a lot. But if you're in an area where you don't get NHS treatment, we can also help just by dialing the patient inquiries team, or phone your local clinic like ours on the docks in Liverpool. We've got them all over the country, and we are here to give you the best chance of achieving your family. So, gosh, that was a quick half an hour. I hope that was useful. If we haven't answered your questions tonight, then just email them through. We've got girls, we've got in Liverpool, we've got Amanda and Ashley and Ella, Kathy, Helen, who are only too willing to answer your question. Don't just sit there stressed out, because it's not nice, particularly when you've got an already stressful disorder like fertility. So there we are. We've got another webinar coming up next week, and I'm talking with Ali Campbell, and we hope I'll see you again sometime for another round of questions. And if there's any topics you want to discuss, then I'm only too happy to spend half an hour rambling on and giving my thoughts. And as I say, the patient inquiries team are there for you to answer any queries as well. So good luck, have a nice evening, and I will see you all soon. Good night.
informative, and yeah, it's very